Today we are going to talk about protein electrophoresis. I don't know if you have ever come across this investigation or not, but this is a very peculiar investigation, and in which what we do is that we take a sample of the blood, and blood also contains different types of proteins in the serum part, and that current is then passed through this blood, and based on the molecular weight of different proteins, they either go towards the anode side and cathode side. So then this is plotted on a filter paper as a graph is created, which we call as protein electrophoresis. Normally, protein electrophoresis is ordered when you are suspecting gammopathies, which are basically problems in the gamma proteins, or sometimes if you find out for one reason or the other reason that the serum proteins are either elevated or they are decreased, sometimes in certain form of kidney disorders, liver disorders, and even in neurological disorders. So in all these things, protein electrophoresis is done to aid in the diagnosis. So let's dive in and further talk about how do we interpret this protein electrophoresis. So normally, if you look at the protein electrophoresis graph, you would see that it mimics your fist in this peculiar manner. So I don't know if it might be showing you the mirror image, but you just have to flip it. So let me put it this way. So the first spike is your albumin levels. So albumin is one of the major components of your plasma protein. So the first spike is actually your serum albumin levels. Then you've got like three small humps. So the first one is the alpha-1 protein. Then you've got the alpha-2 protein. Then you've got the beta protein. So these are very small humps, which are almost more or less similar in terms of their height. And then there is a slightly bigger and broader hump, which is for the gamma proteins. So this is how you would see a normal protein electrophoresis. First sharp spike is of albumin, then three small humps. So going from this side to the other side, alpha-1, alpha-2, beta, and then gamma. So these are the different proteins or globulins as we call them. So this is how you would normally see our protein electrophoresis. So based on the different disorders, these humps can go up and down. So let's talk about the first one. Albumin, we all know. I would come to the albumin problems in some other lecture. For the time being, we'll be talking about these other like rare proteins, the alpha-1, alpha-2, beta, and gamma globulins. So the first one is alpha-1 proteins or alpha-1 globulins. Excuse me. Now, the alpha-1, if you think what comes into your alpha-1 antitrypsin deficiency. Now, alpha-1 antitrypsin deficiency is a peculiar type of genetic disorder in children, in which there is a deficiency of this alpha-1 protein or alpha-1 antitrypsin protein, and that leads to chronic liver disease, chronic lung disease. There are emphysematous changes in the lung tissue, and the liver goes into cirrhosis. Nevertheless, because it's alpha-1 antitrypsin deficiency, so if you see that this alpha-1 hump is actually flattened, there's no alpha-1 hump. Basically, you might be dealing with alpha-1 antitrypsin deficiency, which is a genetic disorder of children. But if you see this bit of the protein or the electrophoresis going a bit up, so if there is an increase in the height of this hump, it means that the alpha-1 antitrypsin levels are elevated. And alpha-1 antitrypsin is also an acute phase reactant. So in inflammatory conditions, you would see a rise in the hump of the alpha-1 protein part in this electrophoresis. So an increase means inflammation, a decrease means alpha-1 antitrypsin deficiency. Now, moving on towards the other hump, and that is the alpha-2. Now, alpha-2 proteins actually are your haptoglobulin, your ceruloplasmin, which actually is a very important component in Wilson disease as well, and the alpha-2 macroglobulin. So three things: ceruloplasmin, haptoglobulin, and alpha-2 macroglobulin. These are part of your alpha-2 proteins or alpha-2 globulins. Now, if they are increased, normally they are increased in what we call as inflammation. So alpha-1 and alpha-2 both can be increased in inflammatory conditions. So let's say if there is some form of chronic inflammation going on, you might see that protein electrophoresis shows a hump in alpha-1 as well as alpha-2 parts of the protein electrophoresis. So like, for example, in this diagram on the side, if you look at this side, you can see that there are humps on the alpha-1 and the alpha-2 bits of this protein electrophoresis, and that means that this is an inflammatory condition. So there is some form of acute inflammation going on. Then coming to the third hump next to the alpha 1 and alpha 2, and that is the beta region or the beta globulins. Now, beta globulins are again further subdivided into beta 1 and beta 2, but usually on the protein electrophoresis, we just take as the beta hump. Now, what are your beta globulins? Your beta 1 is actually transferrin, and transferrin, is the transporter protein for iron, while the B2 component of the beta globulins, that is actually your beta lipoprotein, LDL beta lipoprotein. So if you look at this this graph over here, especially the one in the red, you will see that the albumin level or the albumin hump is slightly reduced as compared to the normal one. The normal one is given as the top and the other one is given at the bottom. So as compared to the normal protein electrophoresis pattern, you can see that the one which is given on the lower side has got decrease in albumin levels because the albumin spike is low. The alpha 1 spike seems more or less normal, but then you can see the alpha 2 spike and the beta globulin spikes are elevated. So they've got me. So what do you think? Can explain this thing? Decrease in albumin and an increase, which you call as a compensatory increase in the alpha 2 and beta globulins. Think on that. And that, yeah, you were very right if you have guessed correctly. That is nephrotic syndrome, okay? So in nephrotic syndrome, what happens? Because there is hypoalbuminemia, because the albumin as a big blood protein is being filtered out in the kidneys, the body tries to compensate it by producing the alpha 2 and the beta globulins. So the liver actually increases the production of those proteins. So that's why you find it a bit higher on this protein electrophoresis graph. And with that, in nephrotic syndrome, you would know that sort of only hypoalbuminemia, but there is a nephrotic range proteinuria as well. There is edema, and there is hyperlipidemia as well. And this hyperlipidemia is because of this, increase in the lipoproteins. So basically, there is this loss of albumin, which leads to compensatory increase in the alpha 2 and the beta lipoprotein. So that's what you will find in a case of nephrotic syndrome. Then, if you look at this protein electrophoresis, so this was a young adult who actually had developed anemia over a prolonged period of time and has also been complaining of bone pain. So obviously you're thinking some form of cancer, and one thing that comes into mind is this myeloma. So if you look at this graph, you can see a spike in the albumin levels, and then you've got these small humps. But if you look at the small humps, you see that the alpha 2 is slightly greater than the alpha 1. There's a slight increase in the beta hump, but then you see that there's a sort of a bridging between the beta and the gamma globulin. So the question is, person with anemia, and with anemia there is bone pain. So what is the relationship between these things? And the relationship between these things is that basically this is iron deficiency anemia. So in iron deficiency anemia, the transferrin levels, transferrin, which is a transport protein for iron, what happens? That actually increases. So when that transferrin increases, so what happens? You get this beta 1 spike on the protein electrophoresis. So this basically is not multiple myeloma. Because why? Why there's not multiple myeloma? Because we are not seeing any increase in the spike on the gamma globulin side. The gamma globulin side is almost flat. So this is not myeloma. Rather, you see a spike in the beta section of the beta globulin. So this is basically an increase in transferrin levels. And this anemia is basically iron deficiency anemia, which is causing this increase in transferrin, and hence this picture of the plasma protein electrophoresis. Moving on, this type of protein electrophoresis in which you see a decrease in albumin, but then there is some increase in the gamma globulins and some increase in the beta 1 as well, with some bridging, is actually indicative of cirrhosis liver, because in cirrhosis liver is not able to form albumin, so the albumin levels relatively go down. But at the same time, the what happens is that there is a compensatory increase in the gamma globulin levels. I'm not sure about the exact pathophysiology why this happens, but they say with cirrhosis there might be some form of portal hypertension, and the gut antigens, they usually bypass that and they directly go into the bloodstream and maybe present it to cells, and then it leads to the extra hepatic production of these gamma globulins, and that leads to a bit of increase in that. So in cirrhosis, you will get a decrease in the albumin levels and a little bit of increase in the gamma globulin levels. And that is actually what you see in a case who has got liver cirrhosis. Last but not the least, then if you have got a spike at the very end, that is the gamma protein levels, that's obviously what we call as a multiple myeloma. They can also be detected in the urine as well in the form of Benz-Jones protein. The usual question is that what sort of gamma globulins are there? Again, if you go through commonality, usually it's the IgG and IgA. So IgG gammopathy is more common as compared to IgA, though we do need to have some more testing, like immunofixation testing, to see if what type of immunoglobulins are actually increased when we are talking about this increase in the height of the gamma globulins band. But most of the time it's the IgG gammopathy followed by IgA gammopathy. So IgG multiple myeloma is more common as compared to IgA1. And if you get a flattened one, like we'll show you this one, so if you get a flattened gamma globulin site, of the protein electrophoresis, you are dealing basically with hypogammaglobulinemia. Hypogammaglobulinemia means that you are low on the gamma globulin side, and that would require further testing through flow cytometry or subclassing of the gamma globulins to see whether it's IgG, IgA, IgE, or pan-hypogammaglobulinemia. But these types of hypogammaglobulinemia, children would be presenting with frequent, repeated bacterial or viral or a combination of bacterial or viral infections. So in protein electrophoresis, you will get basically a flattening of the gamma globulin part of the this protein electrophoresis pattern. So that is how you interpret the protein electrophoresis. So in a nutshell, again, you should know that the normal protein electrophoresis is actually in the form of this, where there is a normal spike of the albumin followed by 3 same-sized humps, alpha-1, alpha-2, beta globulin, and then this smaller but like slightly bigger hump as compared to these three, which is known as the gamma globulin section. So again, if there are increases and decreases in these relevant sections of the alpha-1, alpha-2, beta, or gamma, they can indicate different types of diseases. And if you know these patterns that I have explained in this particular video, it would be easy for you to understand those common conditions which can present with either increase or decrease in this different types of plasma proteins in their respective sections on the protein electrophoresis. So I hope you enjoyed this video. And if you still think that something is not clear to you, you can ask me your questions in the comment section below. And if you want me to explain some more interesting topics to you guys, just let me know in the comment section below. I'll be more than happy to make further videos for you guys. So have a very good day. Take care and bye-bye.